Good day, everyone, and welcome to another health session from Healing Africa. I'm Melvin B. Kura, your host for today, and I'm excited to have you joining us for another interesting conversation on a very important health topic. So today we are going to be diving into a subject that is often overlooked, but it has deep impact in our society, and that is postpartum depression. So the reality is that postpartum depression is real and it affects countless of women worldwide. And most times these women suffer in silence. So today we are going to be discussing that. And we have an incredible guest, Dr. Lorraine Morris from Jahmale, who is going to be unpacking all of this. So you're welcome to the show.
Thank you, Melvin. It's a pleasure to be here.
Okay.
And I'm really happy to be able to talk about this important topic.
Okay. So before we go on, you can just introduce yourself to our audience, let them know more about the Lawrence Morris, what are you about and what you're into.
Sure.
Yeah.
So my name is Dr. Lorraine Morris. I am a general practitioner here at Jahmale Medical Solutions. I am a Liberian. I am a child of God. I'm a mother and a wife. I'm very passionate about helping people, empowering people to really be who God created them to be. And one of the ways that I do that in my life is through my work as a doctor, partnering with people so that they can fully live healthy, full, passionate, empowered lives. So that's a little bit about me.
Yeah, so thank you for that introduction. So from that we see that you're really passionate about this and then you bring a lot to this discussion. Okay, so talking about postpartum depression. So let us know what is postpartum depression and how can a mother try to differentiate it from just normal post-birth changes.
Okay.
Yeah.
So I recently found out that actually they changed the name from postpartum depression to perinatal depression.
Okay.
Because it basically recognizes that it can affect women during pregnancy as well as after pregnancy. So it's essentially depression, and I will go into what that is. Depression that affects women during pregnancy and within the first year after giving birth or after having a miscarriage. And so about 85% of women experience what is referred to as baby blues. And that's basically where they feel tearful, maybe a little more agitated or irritable or anxious in the first week or two after giving birth.
Okay.
And that is thought to be most likely due to the hormonal changes that happen after birth. Because during pregnancy, your reproductive hormones increase significantly, about 10 times their normal level.
Okay.
So, and then within that first week after giving birth, the hormones come down very drastically. So some women can experience mood changes due to that change in the hormone levels. So that is very, I would say, normal, the baby blues. But postnatal depression is actually where a woman is experiencing symptoms of depression for longer than that initial 2 week period. And I'll just go into basically what depression is.
Yes.
So depression is the two hallmark symptoms of depression is low mood, irritability, loss of hope, feeling of hopelessness, feeling of emptiness. And the second thing is loss of interest or pleasure in the things that you previously found enjoyable. So those two symptoms are the hallmark symptoms of depression. Depression overall is a mental disorder that negatively impacts the way you think, the way you feel, the way you act, and the way you perceive the world. So it has an impact on all of those aspects of yourself. And in addition to those two hallmark symptoms that I mentioned, people also experience a range of other symptoms like change in their appetites. So they can either have increased appetite where they're binging all the time, or loss of appetite. They can experience change in their sleep patterns, where they're not able to sleep or they're sleeping all the time. They can have feelings of guilt, feeling guilty for no reason. They can experience very dark and negative thoughts, sometimes harmful thoughts about themselves or other people, and in severe cases, actually wanting to end their life. In the case of postnatal depression specifically, women can feel very inadequate. They can feel that they're not good mothers. Some of them can be overly anxious about their baby. It's quite common for mothers to be anxious about their babies, but overly so. And also, in some severe cases, have thoughts of harming their babies, or even concerns about their ability to care for their babies. So these are all potential symptoms that people can experience with postnatal depression. And so the difference really is the severity of the symptoms, because with postnatal depression, the symptoms are so severe that it actually impacts their ability to carry out their day-to-day life, and usually requires some sort of medical intervention.
Okay, that is great. Thank for that detailed explanation between postpartum depression or the prenatal, like you're saying, depression and the baby blues. So, like as you're saying, so that means that there are some women. The mentioned statistic is 85% of women after birth experience the normal emotional changes.
That's
So
right.
only few of them actually go into the postpartum depression aspect of it. So,
Yes.
I want to know what are some risk factors that make some women more vulnerable to experience postpartum depression.
Okay.
Yeah.
So, having a history of a mental health illness,
Okay.
like depression or anxiety, having a prior history of that before that pregnancy is a risk factor. Having a family history of mental illness is also a risk factor. Um, Having very difficult relationship situations, for instance, being in a relationship where there's domestic violence, um, or just a lot of instability, that can be a risk factor as well. Having lack of social support. So they say, particularly very young women who don't have a lot of family support, or where perhaps the partner is not supportive, or the partner um, doesn't want to be involved, things like that. Those are all potential risk factors for perinatal depression.
Okay, so that's great. Thank you. So, let us know some of the impact of postpartum depression, especially on the mother, and also how does it affect her bonding with her baby, and
Mm.
also yes, how does postpartum depression affect the well-being of the baby as well? So,
Okay.
what are some of the impacts
Yeah.
of it?
So, as you rightly said, it impacts everyone.
Yeah,
So
yeah,
it
yeah.
impacts the woman, it impacts the
Baby.
baby, it can impact her relationship with her partner. If she has other children, it can impact them as well. So, in terms of the impact on the woman herself, of course, it has a massive impact on her emotional well being, because we talked about all the different emotional symptoms that she's experiencing. And so that will inevitably affect her ability to bond with her baby, her ability to care for herself as well as the baby. And so, and in addition to the emotional symptoms, she can also have physical symptoms, because if you're not, so many women who suffer post or perinatal depression tend to have poorer nutrition. There is a higher risk of them being involved in substance abuse as a coping mechanism, sleep disorders. So all of those things can then impact your physical health. So her physical health is also likely to be more impacted. And then, as I said, the bonding with the baby. So even actually, even during pregnancy, women who undergo or experience depression during pregnancy are more likely to have premature deliveries. They're more likely to have babies who are low birth weight. Um, and then, and then they are more likely to have issues with feeding, like breastfeeding.
Okay.
And then there are actually some longer term um, impacts that can happen with the babies and with the children as well. They're more likely to have problems with their cognitive function, how well they can think and reason critically, with emotional um, well-being, and developmentally they are more likely to have problems like how early they can sit and walk and talk and those kinds of things. It can also have an impact on that as
Okay,
well.
so that's great. So moving forward, we have talked about the causes of it. We have talked about some of the major signs and the risk factor and the impact of it. So let us look at also the treatment aspect of it. So what are some of the treatment options that are available for mothers that are suffering from postpartum depression, and also maybe lifestyle changes? What are some of these things?
Yeah.
Yeah, yeah.
So I'm glad you mentioned lifestyle changes because that's really important. So when it comes to treatment, it's really good to have a holistic approach.
Mm.
And so the first thing is ensuring that she has adequate support, because there are some practical things that have to happen. She has this baby she has to care for now. So ensuring that as she's recovering, she actually has the support she needs, helping to care for the baby, allowing her to have enough time to sleep, making sure that she will have her meals, prepared and ready and all of those things. So just getting that practical support in the home is very important.
Okay.
Diet is really important. So eating lots of healthy, fresh, like fruits and vegetables. Fish is something that's really good for brain health. So fish and healthy fats, so things like avocado, those kinds of things are really helpful for brain function. And just overall balance, healthy meals. Exercise is wonderful. Regular exercise daily helps a lot with depression. So that's something that's really helpful. And then what's referred to as psychological therapies is also beneficial for this. So that's, or sometimes referred to as talking therapy. So basically
Yes.
going to see a psychologist. There are different types of therapies that they do. There's something called cognitive behavioral therapy, where they look at like thought patterns and behavior patterns, because there might be things that have been brewing for many years that she hasn't addressed.
Mhm.
And then it's like a goal oriented structure way of therapy where they look at how she can change her thoughts and thought patterns to have different outcomes. There's something called interpersonal therapy where they look at her relationship with people and how she interacts with people. So that's a really big part of the treatment. In severe cases, medications can be given.
Mhm.
There's one group of antidepressant medication called SSRIs, and they basically increase the level of a brain neurotransmitter called serotonin, and that is thought to help with depression. So it's a medication that is typically used to treat depression, and it can be used to treat perinatal depression as well. In pregnancy, there are some that are not safe for pregnancy, so it's something that really has to be managed by a specialist. Um, and so they will have to go with one that is the least potentially harmful. Breastfeeding is a consideration as well, but there are some that are thought to be safe in breastfeeding. But usually it tends to be a last resort. So if the therapies and the other measures are not helping, then they might step in with medication. But those are the treatment options.
Okay, so all these treatment that were mentioned, are they available, especially the therapy aspect? Is it available locally?
Yes,
Can
I
you
am
ask?
very happy to say yes.
Okay.
So there is a clinic. Actually, I've only recently found out about this clinic. I'm so excited about this clinic. It's actually based in Syncor, and it's the acronym is Anchor, and I'll have to look down to make sure I'm getting it right, but it's called the Africa Neuropsych Center for Healing Outreach and Research. So they have trained clinical psychologists. In
Okay.
fact, I believe they even have a program for training psychologists there. They treat a range of mental health conditions like depression, anxiety. They specifically do perinatal depression. I've asked them.
Okay, that's great.
They treat PTSD, and they even treat addiction issues, so substance abuse issues. So I think it's a really great resource. So they have a website, so maybe you can.
Check it out. Yeah,
Yeah,
we will post
that's
that. Okay, so thank you. So talking about support as well, we know
mhm.
environment is very very key. It's a key factor, like you mentioned, the diet, the exercise, and also sleep. So let's look at the support as well. What are
Mm,
some role partners, mothers, or let's say family or the communities can play in supporting mothers that are facing this condition,
okay.
postpartum depression?
Right.
Yes.
So I think the first step is actually just acknowledging what's happening to them, because a lot of people, when they're going through this, it takes a lot for them to actually admit it to somebody else, even people they're very close to. There can be some shame associated with it. And so the first step is for them to just be good listeners, and kind of accept and open themselves up to their loved ones
Okay.
so that they can share what they're going through,
Mhm.
and be there for them in that way emotionally. Also, if they know someone who's going through something like this, um, I would encourage them to go and seek medical help.
Okay,
So,
that's
like
essential.
this clinic I just mentioned, or their own doctor that they feel comfortable with, just go and actually seek some medical assistance. And then they can also help in the practical ways that I mentioned, because there are lots of practical things that a mother with a young child has to do.
Yeah.
So, having someone who can actually help them do those things can also help them in their recovery.
Okay, so that's great. So what are some practical advice, your own personal advice you would give to a mother who is actually overwhelmed, who has some of these symptoms of the postpartum depression, but it is afraid to seek help, either professional help or social help. So what
Mm,
advice would you give to such a mother?
okay. So I would just say you're not alone. There are many, many women who struggle through exactly what you're going through. So just know that help is available. You're not crazy. What you're going through is a recognized medical condition, and there is treatment for it. And many women with the right treatment will recover and will get through this. So please, please, please go to your doctor. You can come to see me if you like here at Jahmale,
Okay.
and I will happily sit with you, talk with you, and help you in your road to recovery.
Okay, so that's very helpful. Thank you. So as we try to conclude, what are some key takeaway that you want participants or let's say viewers that are watching this session to let's say carry out to carry? What are any key takeaway they should take from this session? If there's one thing they could take or any key takeaway you think that is very
Okay.
helpful for our audience.
So, first of all, I just want to say you are valuable, okay?
Okay.
And your health isn't just your physical well being, it's also your psychological, emotional, spiritual well being. And if any aspect of that is not going well, then it has an impact on many other things. So um, I just want people to try to remove that stigma away from like mental illness and realize that, whether it's physical illness, mental illness, it's pretty much all the same. And so help is available. We are here, like we here at Jahmale are totally dedicated to patient care. So yeah, please come and see us, reach out if you're experiencing any issues with regards to your mental health or any other problem for that matter.
Yeah, yeah. So thank you. So that will try to close us to this. So I want to extend our voice to any mother out there that is also suffering with any of these conditions to seek professional help, especially like you said, Jahmale. Yeah, so they have experts, they have people who can help with these conditions. So you have to speak out. The one of the things, as I was saying, is the lack of awareness. Most people are not informed about what's happening to them. Yeah, so the information, that is why we try to provide the awareness as part of it. So I want to thank you for taking your time to explain this to the audience. So I also want to encourage those that are watching this. So if you found this help session valuable, don't sit on the information, share it with someone else. You can even share the video as well. So we thank you for tuning in to this help session and continue to engage with us. We have more help sessions coming up. And until then, stay informed, stay healthy, and be safe. Thank you.
Thank you, Melvin.
Yeah, thank you.